Welcome to The Explainer. Today, we're tackling a threat that isn't making headlines with a loud bang, but is instead unfolding in a persistent, dangerous whisper. It's a crisis that could quietly dismantle modern medicine as we know it.
And this really gets to the heart of it. While we're all watching for the next big, flashy outbreak, this is the crisis that's already here, unfolding right now in our hospitals and on our farms.
So, what is this threat exactly? Well, experts have a name for it that's pretty fitting: the silent pandemic. Let's dive into what that actually means.
Basically, what we're talking about is an evolutionary arms race, and we're starting to lose. The microbes, bacteria, viruses, you name it, are learning to survive our best drugs. This means common illnesses that we've treated easily for decades are becoming potentially deadly all over again. And this isn't some far-off future problem. It's happening right now. Okay, so how do these superbugs even come to be? To really get a handle on this, we've got to get our terms straight. Because, it's about way more than just antibiotics. We hear the term antibiotic resistance all the time, but honestly, that's just one piece of a much bigger puzzle. As you see on the left, antibiotics specifically target bacteria, but the real overarching threat is antimicrobial resistance. That's the umbrella term on the right. It covers resistance in a whole range of microbes: viruses, fungi, parasites, the whole shebang. Our entire medical toolbox is what's at risk here.
So how are they pulling this off? Well, these microbes have developed some seriously clever survival tactics. Some of them produce enzymes that literally chew up a drug before it has a chance to work. Others have these tiny pumps on their cell walls that just spit the medicine right back out. And some even change their own structure. It's like they're changing the locks on their doors, so our key, the drug, just doesn't fit anymore. They are actively outsmarting our best medicines. Now look, a certain amount of resistance is natural. It's just evolution doing its thing. But what we've done is slam our foot on the accelerator, putting this whole process into hyperdrive. There are a few key reasons why this is happening so fast. First up, it's happening right in our own clinics. Think about it. Every time an antibiotic is prescribed for a virus, like the flu, it has zero effect on the virus. But what it does do is give all the bacteria hanging out in your body a free training session on how to beat that drug. The same thing happens when we start to feel better and stop taking our prescription early. We're basically just killing off the weak bacteria and leaving the strongest ones to multiply. Second, let's talk about our farms. The sheer volume of antimicrobials used in agriculture is just staggering. And a lot of the time, it's not even to treat sick animals. It's used to speed up growth or prevent infections in crowded living conditions. And guess what? Those new, tougher bacteria don't just stay on the farm. They can travel right into our food chain and water supply. And third, our environment. In many parts of the world, a lack of basic sanitation and clean water creates the perfect storm. It's a breeding ground where resistant germs can emerge, spread, and even swap their survival tricks with each other, getting stronger and spreading like wildfire through whole communities. And finally, there's this problem that some call the discovery void. So, at the exact moment microbes are evolving faster than ever, our ability to find new weapons against them has pretty much ground to a halt. Why? Because developing new antibiotics is incredibly expensive and, frankly, not very profitable. So, a lot of drug companies have simply abandoned the search. So let's just pause and think. What does a world where our medicines stop working actually look like? This isn't just a small inconvenience. The stakes couldn't be higher. We are literally talking about the potential return of a pre-antibiotic era.
Think about it. So much of modern medicine, C-sections, organ transplants, even cancer treatments like chemotherapy, is built on one fundamental assumption: that we can control infections. Without effective antimicrobials, those routine, life-saving procedures become a life-threatening gamble. That very foundation of medicine is cracking.
The economic threat is just as staggering. This isn't just a health crisis, it is an economic one too. The World Bank projects that by 2050, AMR could add over $1 trillion to global healthcare costs. $1 trillion. And the fallout is systemic. It hits everything. In our hospitals, routine procedures become high risk. For the global economy, we could see a significant hit to GDP. And for global health, decades of progress against huge diseases like TB, malaria, and HIV could be undone as our treatments become useless.
Now, I know that all sounds incredibly daunting, and it is. But it's not hopeless. There is a blueprint for fighting back against these superbugs. So what's the plan?
The solution starts with this idea called the One Health approach. And it's really common sense when you think about it. We can't solve this problem in a vacuum. Human health, animal health, and the environment are all deeply connected. So our solutions have to be connected too. It requires a coordinated effort across all these sectors.
On a global scale, the strategy really rests on 4 key pillars. First, better surveillance, so we can track where and how resistance is spreading to get ahead of it. Second is stewardship. That means using the precious drugs we still have more wisely, only when absolutely necessary. Third, vaccination, because hey, preventing an infection in the first place is the best way to avoid needing treatment. And fourth, innovation. We have to find creative ways to restart that stalled drug development pipeline.
But this isn't just a problem for governments and drug companies. Our individual actions form the most important line of defense. Simple things like only using antibiotics when a doctor prescribes them and finishing the full course even if you feel better. Practicing good hygiene like washing your hands. Even making informed choices about the food you buy. These things can have a massive collective impact.
And ultimately, that's the question we're all left with. Preserving these life-saving drugs isn't just a scientific challenge, it's a social one. It means we have to shift from just using these miracle drugs to becoming their guardians. And that really depends on the choices we all decide to make, starting today.